So good morning and good afternoon to all. Thank you for joining this live session. With us, we have all the panelists that have contributed to the panel on this session. And we have received several questions that I would like to ask to our panelists. And the first question that I would like to make is that the challenges in the fight against COVID-19 in Africa are well documented. How do we better prepare for future pandemics, in your opinion? Who from the panelists want to take the floor? Over to you.
So if I may jump in here. One of the things that happened over the last few years prior to the pandemic and the onset of the pandemic was the fact that many countries had undergone the joint external evaluation and had looked at their systems in terms of their health security infrastructure. And it showed clear weaknesses in many of the countries. You know, it was clear to countries where they needed to improve in the whether they were in the area of prevent, detect, or respond. And a lot of those gaps were the things that countries started working on. And most countries have developed a national action plan for health security. And for instance, in Nigeria, that was done. And those critical gaps were being addressed. Going forward, some of the critical things that we've seen have been gaps in health systems, gaps in human resources, gaps in funding for health security, and finally, gaps around coordination. Most African countries have done reasonably well around risk communication, engaging with the population, and so on. But these are the 5 core areas that I would say going forward that a lot needs to be done. And the last point is really around rethinking what we understand human health security to be. Health system strengthening, universal health coverage, primary health care, health security are all linked quite clearly. And so it's important to look at building all these systems and not working in isolation. I think that's all from me. Thank you.
Thank you very much. Other comments? Yes, please, Hitesh, go ahead.
No, just to add and complement there. I mean, I think a few issues that come to mind in regard to how we can be better prepared, and I think we've seen some of these issues play out in real time now. And I think I made reference to this in the discussion, is around procurement of commodities. I think one thing we've seen from 2020, even up till today, is that the inequity in the way commodities are procured and then allocated to countries. And you know, with the advent and with the creation of, for example, the Africa Medical Supplies Platform by Mr. Strive Masiyiwa, and on behalf and in support of the Africa Union, it was really a sign that the continent was looking to take ownership of its own global health security, starting with procurement of COVID critical items, the PPEs and non-critical items as well. And then, as things evolved, we saw that with the inequities prevailing insofar as access to vaccines, the continent also then moved forward to secure its own supply of vaccines. And so, if we take a step back and just looking at how, a continent with a population of 1.3 billion was looking to secure its own global health security, procurement, it's regional procurement of commodities that allowed it to, provide for its own people. So that's one thing I would say. It's preparing for the next pandemic, and I don't like to say preparing because we're right now in a pandemic, but I would hope that structure like the AMSP would continue to live. Its longevity would last for pandemics to come. The other thing, and I would also add is, I just like to point to the recent successes of African vaccine manufacturers, looking at a group like Aspen Pharmaceuticals in South Africa, who have really shown and demonstrated their capabilities to even manufacture vaccines in the continent, in addition to other manufacturing companies in various regions of Africa. If we can look at that North-South cooperation, for example, how a company like Johnson & Johnson and Aspen work together to show licensing of vaccines for, again, the manufacturing of this product for Africa. I think that's a very good example that we can take forward as well, looking into the security of continents such as Africa. So those are sort of the two things that come to mind. I think that we can play on for the next time would be beneficial. Thank you.
Thank you very much. Yeah, Doc, please go ahead.
Yeah, thank you. Yeah, thank you very much. So just a couple of things to add to what my colleagues have said. Really important. But I've just got to try. I'm trying to anchor it on the fact that there will be times of calm between pandemics. Yes, thankfully for COVID, yes, there are vaccines right now. That's also helping to manage and get countries ahead of the curve or ahead of things to manage mortality and fatalities in country. But specifically for the next outbreak, from the lessons we've learned in COVID, there's a significant amount of work that we need to do on risk communication and community engagement. It's really essential that those are entrenched and those are better improved and is systematic. What we've seen with COVID is that there seems to be a lot of this work in silos, but you are actually going to activate the same system for the next pandemic. So there's no better time to begin to entrench those such that when the next pandemic comes, we know what we need to do. We have the requisite systems to be able to address vaccine hesitancy and a lot of the issues that will affect a lot of the responses to a subsequent pandemic. But within the response, there are things that countries also need to do. So pre-positioning of commodities. So we talked about PPEs, we talked about vaccines. The JEs have highlighted that under the medical countermeasures technical area, for example, but that needs to be actionable and well planned and well thought of. Of course, you can't keep these commodities without having the requisite coaching equipment, for example. So being intentional about getting those in place, but also maintaining the crop of equipment in the system is also very essential and key. The last bit I want to emphasize, I think Dr. Agogo mentioned that, is on funding. But what I also want to add to that is there seems to be a disconnect in countries about what, and it's not a disconnect, but the understanding is that the processes for emergencies and fund release in emergencies is different from what you do in routine services. Frankly, I think we need to do better as countries, or countries need to be able to mainstream the process so that there is little to no friction in any of this. Where there needs to be any adjustment, this needs to be done quickly and rapidly, so it doesn't become a bottleneck to any of the responses that the countries are trying to have the response to the event of public health importance, basically. Over.
Thank you very much. I think that Mrs. Naomi also would like to take the floor to respond to this question. Please go ahead.
Hello. I missed the question when I was transferring to this. Do you mind to share the question?
Yes, of course. The question is the following. The challenges in the fight against COVID-19 in Africa are well documented. How do we better prepare for future pandemics, in your opinion?
Thank you so much. Actually, as the question goes, we as an African state, and more so even trickling down to the East African countries where Kenya is situated, we equally faced that challenge of the COVID-19 vaccine. But what I can generally say, not the government statement, but my own opinion, and based on the organization experiences as Kenya Red Cross when we were supporting the response, is that lack of enough preparedness for major epidemics has been a key challenge in Kenya. But I think we've learned so many lessons in the current epidemic, and in the future, we are sure we'll do together. What maybe we missed also is the involvement of the key stakeholders who are the community. All the diseases are centered at the community. So even if at the national level, we have all the measures put in place and shelved up there without making the community become resilient, that's where we miss it. So as a state, we should always ensure that our response mechanism, our preparedness are bottom up, because the recipient of all these services and the preparedness mechanism will eventually trickle down to the community. So I think the best thing to do is always putting the community as the most important stakeholder in all our preparedness and response mechanism. And we can achieve this by always ensuring that there is great resilience, that the preparedness measures have been put from the community level, coming upwards through the counties or the local government, and up to inform the strategies and the policies which are being prepared at the national level, as opposed from making preparation at the national level, then trickling it down. The community will not always understand, but if we do the fight faster, the community will benefit better than they have been before. So if we can have better preparations in future, we'll be able to tackle any other. So I believe even Kenya learned a lesson through this pandemic of COVID-19, and this will inform better planning mechanisms. That is my take.
Thank you very much. Other comments before I go to the next question? If not, I would like to add just a point to these preparedness activities. The movement of goods between the different countries is also key. We are working very hard to make sure that mechanisms are in place to facilitate and speed up the movement of goods within the continent in Africa. So it's very important to raise awareness and to be in contact with the different customs administrations and regulatory agencies, so that they work together and harmonize the different procedures and mechanisms to facilitate the movement of goods. So this is something that we have learned from the pandemic so far, is that each country is having its own rules and regulations, where there is really a need to harmonize to facilitate this movement for humanitarian actors. So thank you for that. I'm going to read the second question that we have received. A new risk to health is the epidemics of rumors. Some call it infodemics. This is the rapid spread of information of all kinds, including rumors, gossip, and unreliable information. They are spread instantly and internationally through mobile phones, social media, the internet, and other communication technologies. A proliferation of web-based experts with diverse and often contradictory views, generating confusion, anxiety, and even panic in times of serious infection outbreaks. The question is, what are the measures taken by your organizations regarding risk communication?
I can give it a whirl.
Please go ahead.
I mean, you know, we obviously the World Food Program is we don't. I don't believe we've done a lot insofar as like risk communication, because we don't do much of the implementation work regarding some of the issues that we are seeing now. But I can say in general, what we've been seeing, and this is such an issue, you know, it's just starting even in the country where I live in, which is the United States, is just the messaging coming out from, you know, different groups and factions within the US around, you know, the current pandemic and what needs to be done to counter that. And the way it's spread throughout the world has just been really fascinating as well, but also dangerous. You know, I think it was in the last question, my peers here spoke about, the need for financing to support risk communication at a very granular level and at the community level. I think one thing we haven't seen is how the communication plays out at a very again at a very micro level, and then the political leadership that should actually accompany this kind of messaging at that level. If that could happen, I feel that we would get ahead of this if we would see constant support from political leadership, but also at the very micro community level. And I think it's so pervasive now with social media that anything can be found anywhere, and people are susceptible to all kinds of incorrect messaging. So it takes a mountain of an effort to be able to get to the most rural parts of any region, any country. So I think the financing and more targeted messaging, bringing on more partners to support those kinds of initiatives to counter what's going to happen, because this is going to happen again. It's very likely to happen again. This is not going to be the end. So we need to invest more in that kind of thing. So yeah, but insofar as like our organization, this is not something that we do, but in general, I would say that should be the approach going forward. Thank you.
Thank you very much. Dr. Olukafaso-Minu, please.
Thank you very much, Benjamin, once again. So within our organization, within UNICEF, it's with a lot of country level footprint within Africa, but also at the regional level. There's a lot of work to support countries to navigate the muddy waters with a lot of information on misinformation on vaccines. I mean, of course, a lot of this work had started before now with routine immunization, for example, where there have been similar instances. So through the Committee for Development Department and Unit, there's a lot of work working with communities to address some of the challenges with addressing vaccine misinformation. Of course, a lot of lessons have been learned during those periods, from polio eradication to other essential immunization campaigns to influence and inform the targeted support to countries, but also understanding that information or the mode of dissemination of these bits of information, harmful information, has changed and evolved over time, again, moving with trends in technology. So what UNICEF has done and continues to do is leverage those existing technologies, understand the nuances around the information dissemination within those groups, where required targeted studies that are commissioned to work within the communities, understand. So it's sort of human-centered design kind of approaches to understand the drivers of this misinformation and use that to develop targeted information across board. As Hitesh rightly mentioned, this is relentless, So it seems like the moment you identify and find a trend, it morphs and it goes into overdrive elsewhere. So it's a whole lot of approach to support this, from the organization perspective, but also there's some more aspect of work that people need to do, which is self-verifying information that they get. That might be a bit of a challenge, but that there's that push also to ensure that people don't just swallow or engulf all the bits of information they get online on any available sources. So a constellation of all those supporting national government to strengthen their community engagement approaches, develop more robust risk communication strategies to address not just this pandemic, but also other diseases that vaccine preventable diseases in those countries. Over.
Thank you very much for this contribution. Dr. Emanuela Gogo, over to you.
Yeah, thanks. So a couple of things. I put in the chat a link to the PEC, the Partnership for Evidence-Based Response to COVID-19. It's some work that the Resolve to Save Lives have been doing in collaboration with other partners, and the link is in the chat. And basically, this is like 4 waves of data collection across 20 countries, all across Africa, looking at various aspects in terms of the socioeconomic realities with COVID, the responses to PHSMs, also some work looking at, security implications of PHSMs as a whole. So we looked at also in those reports, vaccine hesitancy in those 20 countries. So that has been a unique collaboration with all the partners, if you check the link, who were involved in it, the London School, Bill and Melinda Gates, and so on. And basically looking at the anthropological and the social aspects of the response. And one of the gaps that we've seen over the years, even with the response to Ebola when it happened, was the fact that our response is very often based on the science and the medicine and the logistics, and forget the fact that we are, what drives epidemics, what drives the pandemic is the way human beings interact. What makes outbreaks happen is actually how we also interact with ourselves and how we interact with the environment. And therefore, there's a need for more anthropological research. There's need for more social research into the sociology and into how people interact. And this is one of the studies that initiatives that begins to unravel that. The other aspect that I'll also that we've been doing is really around supporting messaging. So the way you craft messages and send them out is also important. A lot of the times when we design messages as a health sector, we design them for ourselves. The language is usually very high tech. The language is usually sometimes pejorative. Sometimes the language is also, it can be fear-mongering itself. And so being able to craft the message in such a way that people can understand is very critical. The last bit is also around who passes on the message. And the studies that we did, the PEC reports, asked the question in all these countries, who is the most trusted voice? In some countries, it was the healthcare workers. In some, it was the government. In some, it was the WHO. So that kind of research at the country level to understand who the trusted voices are very important. And the determinants of that include how well the health system is, functions. It also includes the relationship between the population and the health system and healthcare workers as a whole, as well as the trust in government. So in countries where the trust in government is low, you don't expect the government to be the trusted voice to pass those messages. And this is so critical because infodemics, the question was quite broad in saying it can cause fear and panic and so on, but also it can cause deaths. Because I recall during the Ebola pandemic in West Africa, there was a time that overnight messages went out across Nigeria saying that within 24 hours you had to bathe in salty water, and so some people misread it and overdosed on and drank jugs of salt, and there were definitely some recorded deaths. And so beyond the panic and so on, people can actually die when the wrong information goes out. And in terms of the wrong information, we also realized a lot of the conversations that started at the beginning of the pandemic. Many people went out and started buying and consuming huge amounts of chloroquine, ivermectin, just based on the fact that there was a lot of false information going out there. Last point that I'll make is that there are systems in place that can address this. So, for instance, in NCDC and in Nigeria, as well as the EIOS system. These are like event-based surveillance systems that can do media scraping, that can do assessments of Facebook chats, that can do a lot of trawling through the social media platforms to identify these rumors. And this is a system that should be rolled out at the EOS, at the global level, it's there, but at the country level, this can also be developed so that you can trawl and find what the misinformation is specific to your environment and create and craft messages that can address that. So just those points from me, thanks.
Thank you very much. Any more contributions?
Okay, thank you. Maybe I can highlight a few key issues that Kenya Red Cross is undertaking. Actually, in any disease setup, during epidemics, even in routine health programs implementation, Kenya Red Cross has ensured that community engagement and accountability is part or key deliverable in any health programming to accelerate behavior change. So what we did, the measures we took during the current COVID-19 pandemic to enhance risk communication is the adoption of the community engagement and accountability, whereby as much as it has been a regular platform where we always ensure that community is a major participant in all approaches, we ensure that this has been heightened to address any infodemics. And what we did at the beginning, because of the increased stigma and the reduced access because of the hesitancy to the COVID-19 uptake, we put a platform whereby the communities could be able to give their feedback. And then we have officers specifically put in place to be regularly checking the feedback boxes. At the community level, we may not be able to have streamlined feedback. So at the community, we've put the boxes where a community member can be able to drop a letter and say, I don't want to access this vaccine because I fear ABCD. We also have engaged the community volunteers who are accessible at the community. So a community member can always approach the volunteer for the correct information. For the RANET group, we have an online community engagement and accountability line, which is patent. And people can always drop their questions. We have a full-time officer who is able to sort out those issues. And as I have been saying, Kenya Red Cross works closely with the government to ensure that information is sealed and that we've shared information that is counteracting any rumors instead of exacerbating them. So we occasionally hold stakeholders forums with other partners and the government so that we can discuss the heights or the serious cases that need to be addressed to reduce this to work on the infodemics or even reduce the myths around it. So community engagement and accountability is a very important aspect for any uptake of or change of behavior, and Kenya Red Cross has ensured that it's a mainstreamed approach through all the programs during the disasters and during the routine times. Thank you.
Thank you very much for all these contributions. I think we are close to the end of this panel session. So I would like to thank you all for attending the session. Thank you to all the panelists for contributing to the discussion and interesting inputs. And I wish you all a very good morning or afternoon wherever you are. Thank you very much, and see you soon. Thank you very much.
Thank you.
Bye-bye.
Have a good day.